today we are going to talk about alopecia areata. Alopecia areata is an autoimmune disease that attacks your body hair follicle, causing patching hair loss. Mitigation and therapy can help your hair regrow, though severe cases may not respond to treatment. Next, we are going to talk about what is alopecia areata. Alopecia areata is an autoimmune disease that causes patchy hair loss anywhere on your body, but it most commonly affects the hair on the skin that cover your head. Alopecia is a medical term for hair loss, and areata means that it occurs in small, random areas. There are many different classifications of alopecia areata. It depends on the amount of hair you have lost and the areas. First, alopecia areata totalis. You have lost all your hair on your scalp. Second, alopecia areata universalis. You have lost all your hair on your scalp and all your body hairs. Third, diffuse alopecia areata. Your hair is thinning rather than falling in patches. Fourth, ophiaceous alopecia areata. You have lost a band of hair on the bottom back sides of your scalp, occipitotemporal scalp. Who get alopecia areata? Anyone can develop alopecia areata, but your chance of having alopecia areata are greater if you are a child, you have a family history of alopecia areata. You or your family member have autoimmune disorder including diabetes, lupus, or thyroid disease. And what happens if you have alopecia areata? Alopecia areata causes your hair to fall out in patches. The patches are usually small and round, about the size of a quarter, but the shape and amount of hair you lost may be bigger or smaller. And your nail may also develop dents or pits, coperiform depressions. They may make your nail feel gritty like sandpaper. Alopecia areata doesn't typically affect your physical health. However, it can affect your physical socially, how social and social group affect your thoughts and emotions. And physiologically, how you think about yourself and your behavior. You may experience stress, anxiety, and depressions. What are the symptoms of alopecia areata? Common symptoms of alopecia areata include: first, patches of hair loss include your scalp, facial hair, eyebrow, eyelash, and body hairs. Second, nail pittings. Your patches won't typically have any other symptom, but in like case, they may itch. What causes alopecia areata? Alopecia areata is an autoimmune disease that causes your immune system to attack your bodies. Your immune system attacks your hair follicle because it thinks they are forest invader, bacteria, virus, parasites, or fungi that cause infection, illness, and disease. When this happens, your hair begins to fall out. Often it crumbs the size and shape of a quarter. The extent of the hair loss varies. In some cases, it's only a few spots. In others, the hair loss may be more significant, including total hair loss. Your genetics make up the part of your cell that determine your physical traits. Your eye color, height, or hair color may trigger your body autoimmune reactions, or your genetic makeup combined with a virus, another substance you encounter may trigger the reactions. Diagnosis and test. How is alopecia areata diagnosed? Your healthcare provider can usually diagnose alopecia areata through a physical exam. They will ask about your medical history, including when you start noticing hair loss, and whether you have a family history of alopecia areata or autoimmune disease. They may also examine your nails. What tests will be done to diagnose alopecia areata? If your healthcare provider can make a diagnosis after a physical examination of your blood spot, they may examine your scalp for site infections. Take a sample of the hair and send it to a lab for another analysis. Take a scalp biopsy to check for skin disease and conduct blood tests. Areata doesn't go away. Medications and other treatments help manage your hair loss, but they won't cure the disease. Alopecia areata totalis and alopecia areata universalis are more severe and less likely to respond to treatments. Treatment options include: first, corticosteroid. Anti-inflammatory drugs can often used to treat autoimmune disease. Corticosteroids are injected into the scalp or other area, taken orally as a pill or applied topically rubbed into your skin as an ointment, cream, or foam. Second, phototherapy. Phototherapy uses ultraviolet light from special lamps. Third, platelet-rich plasma. A healthcare provider remove blood from your body, process it, and then inject it into your scalp to stimulate hair growth. Fourth, topical immunotherapy. Healthcare provider rub an allergen into your skin to create an allergic reaction, contact dermatitis, which produce hair growth. Hair grow back from alopecia. Alopecia areata can be unpredictable, and some people their hair grow back but fall out again later. In others, the hair grow back and never fall out again. Each case of alopecia areata is unique. Thank you for watching and listening. Goodbye.